So, good day. Our next topic will be about the issues on women, the related health concerns, and the most common of these days is polycystic ovarian syndrome. So, our topic is basically on understanding the basic concepts of PCOS and the health related concerns among women. Once again, I am Dr. Armero, and among the causes of OBGYN visits, these are the top five. So these are the most common reasons why patients come and visit me in the clinic. So what do you think is the most common or the top in the list? Well, of course, number one, pregnancy and prenatal visits. So these patients remember OBGYNs whenever they start to realize that, oh, I'm pregnant, or there's a positive pregnancy test, they go and visit us. Second is menstrual irregularities. So this may be no menstruation at all, spotting in between menses, or heavy menstruation. So those are among the menstrual irregularities. Number three, pap smear, because I think that the cervical cancer awareness has been very strong these days. And I think also cervical cancer is also increasing, no? Even among the young. Women these days are very conscious about the presence of human papilloma virus and the changes that it will cause in our body. And so pap smear becomes very popular. Next is the pain and discomfort. It may be in the middle of the cycle or during menstruation, which we commonly call dysmenorrhea, or there can be pain during contact. So those are it's the fourth of the common causes of OBGYN visits. And last is the breast mass or concerns on menopause. I put them on on the fifth slot because they come tie, nagtie, no? The breast mass and the menopause. This breast mass is most commonly also identified among patients who are in the perimenopause or hapit na, almost there at the menopause phase, or already in the menopause. These women usually complain of hot flushes, depression, cannot sleep, very ill-tempered. So those are the things, and they start to tell me, you know what, doc, I'm very much affected with how I react with things. So these are the five common OBGYN visits. And of course, I will have to highlight this one because although it just is the second of the five top common causes, non-pregnant patients come most commonly because of menstrual irregularities, regardless of the age, the very young, in the mid-reproductive age, or in those nearing menopause. Usually this is the most common cause of gynecologic visits. And so among the causes of irregularity of menstruation, which there are again numerous of them, the most common is polycystic ovarian syndrome, which is why we are going to discuss it today. What is PCOS? So polycystic ovarian syndrome is an endocrine disorder, just like diabetes. Diabetes is an endocrine disorder. Thyroid hypothyroidism or hyperthyroidism is an endocrine disorder. So it's the same with polycystic ovarian syndrome. So there is problems in the hormones that affect the reproductive system, causing irregularity or absent ovulation. And this is very common, 4 to 12% of women. So you will see documents or posters like this. Actually, this is from PCOSchallenge.org. They are just showing that 1 in 10 women are affected with PCOS. And that 50%, as you can see, are undiagnosed. They are not aware, okay? While 50% also will develop type 2 diabetes before the age of 40. If you are wondering why, uy, bata pa man to siya, diabetic na ito, it might be because she is at the risk of an early onset diabetes because of PCOS. And because there are no regular visit to a gynecologist, it remained to be undiagnosed. And it is a diabetes that got diagnosed first before the PCOS. And these below are the common signs and symptoms, which we will discuss shortly. So I would always start with cases, but it's more practical. It's relatable. So our first case is MA. She's a 27-year-old who visited her derma due to severe acne. And further probing, she had irregular menstruation and thus was referred to a gynecologist. So she came to me. Now, on examination, I noticed dark hairs noted at the upper lip, arms, and the legs. And she just said, doc, in ani naman ko, balbonon man gid ko. So she was not bothered by the darkening of the hairs, but she was bothered by the severe acne. And on transvaginal ultrasound, it revealed a polycystic ovarian morphology. So the ovaries look polycystic. While our case 2 is NB, a 34-year-old who visited because she wants to get pregnant already, and she had been unable for the past 2 years. She noticed that her menses come twice every month, or sometimes it skips 1 or 2 months. Now, when asked to remove her mask, the doctor noticed pimple scars, just like case number 1. But she just said, oh, doctora, it's because of my frequent wearing of the mask, which caused the pimple scars. And so she was again requested for a transvaginal ultrasound as part of the workup for her infertility and noticed a polycystic appearing ovaries. Now, how does a polycystic ovary look like? So this is how the normal ovary looks like. From an immature follicle, it develops into a mature and then ruptures during ovulation. And then what is left is the shell we call the corpus luteum until it dies. While a polycystic appearing ovary, from an immature follicle, it remains to be immature. And then therefore, it has turned into multiple immature follicles that accumulates at the corner. No? You will see that there are multiple immature follicles here, and thus we call it polycystic appearing ovary. So is polycystic ovaries synonymous with polycystic ovarian syndrome? Are these terms the same? Let's think about it. All right. Are they the same? The answer is no, they are not the same. Because this is polycystic appearing ovaries, but this is not polycystic ovarian syndrome. I know you have read a lot in Google. You can always search it. No, it's very easy for us, especially these days, especially for the younger ones who are tech savvy. They can already Google it. But according to the Rotterdam criteria for the diagnosis of PCOS, we will be able to diagnose polycystic ovarian syndrome if a patient has 2 out of the 3 criteria. The first is changes in the menstruation, the irregularity of menses, again, which is very common. The second is the signs of hyperandrogenism, or the excess male hormone in the body. It can be tested through the blood. And if it's too expensive, like here in the Philippines now, or specifically in our province, where we are not very equipped with the laboratory test or the finances to be able to afford the laboratory test, there are clinical signs of elevated male hormone in our body. What are those? Acne, bugas, hirsutism, balbonon, darkening, and hair fall. Some would even think, oh, doc, I just thought it was my shampoo. I kept changing my shampoo, but it's the same. The hair fall had becoming severe. So there. The last of the third is the polycystic ovaries. There are polycystic appearing ovaries, of which I have showed you. Once again, polycystic ovaries is just one of the 3 criteria for the diagnosis of PCOS. And we need 2 out of the 3 for us to be able to diagnose PCOS. Because as I'm showing here in the slide, there can be an overlap. There may be some patients who has the 3, regularity of menses, male hormone predominance, clinical signs, and third is the polycystic appearing ovaries. But there are some that even when during ultrasound, there is absence of a polycystic appearing ovaries, they still have polycystic ovarian syndrome because they have irregularity of menses or oligo or anovulation, wala nang itlog. That's why they are not having the regular menses. And they have clinical signs of hyperandrogenism. So this is the classic PCOS. No need to do an ultrasound. But why do you think obstetricians request for an ultrasound? Because there are several other phenotypes. There are phenotype A, B, C, and D, which will affect in our management. Okay, the aggressiveness of our management. So some check tanan, no? Others also just have 2 out of the 3, as I was saying. The classic one just will just present with hyperandrogenism and irregularity of menses, while others will have irregular menstruation only and polycystic appearing ovaries, or irregular menstruation and polycystic appearing ovaries. But according to research, the very important point for polycystic ovarian syndrome is the presence of male hormone, signs of the male hormone predominance. So again, it is important that our patients show signs of elevated male hormones. You try to look at if have you had flares of the pimples. Doc, dili man unta ko bugason, but lately, I have been having flares. Or, Doc, it might be the stress. That's why I'm having hair fall. But actually, it's the elevated male hormones in the body. So this is how the hormones are being processed in the ovaries. So we know the ovaries is the circle beside the mattress, beside the uterus. And so this male hormone, so we have male hormones in our body, but why do we not look like male? Nganong dili man ta bungoton, nganong dili man ta parehas sa mga lalaki? Why do we look like female when we have male hormones in the body? Because the male hormones, before going there, the male hormones is converted into a female hormone through the process of aromatization. This happens again in the ovaries. But when there is problem in the ovaries, no, or there is too much androgen in the body, the too much androgen in the body cannot anymore convert the male hormones into a female hormone. So what happens? It accumulates, and thus causing the problems that we see in polycystic ovarian syndrome. Where does elevated androgen come from? Dok, asa man nagikan ang male hormone? Well, the elevated male hormone comes from cholesterol. The source of our hormones is cholesterol. Where do we get the cholesterol? Of course, in the food that we take in. No? So if there is too much meat, baboy, pork, beef, chicken, egg, no, those are very high in cholesterol, the animal-based food products. If there's too much cholesterol, of course, it will follow that there is high androgen. However, as I was saying, if there's too much androgen, what happens? The conversion into estrogen becomes inhibited. It becomes stopped. And so, instead of being converted in the ovaries, it is now being converted in the periphery at the side, where at the fat cells. Doc, okay, ready ay kay ma-convert the gihapon into female hormones. Yes. However, estrogen that is converted in the periphery is not a strong type of estrogen in comparison to the estrogen that we find in the ovaries. So what is the effect of weak estrogens? So later, I will show to you. So this is how it will look. No? Again, in the ovary, we can convert it into a strong estrogen, E2, while in the skin or in the fat cells, in the periphery, it can convert into a weak estrogen. So what's the difference between the E2 and E1 is that the E2, or the stronger estrogen, is the one that drives the ovulation, or it will cause the rupture of the follicle, but there's too high estrogen, no? Very high estrogen, it will cause the ovulation, it will cause the peak of the luteinizing hormone. And if the estrogen is weak, this is what will happen. Okay, if the estrogen is strong again, no, it will rupture this process. But if the estrogen is weak, it will try to mature, but na hold. It will remain at the immature level, not just one, not just two, not just 10, but around more than 20 follicles in one ovary because they fail to become mature. They fail to ovulate because the estrogen is a weak type of estrogen. What's more, if there is too much cholesterol, there is accumulation of the male hormone androgen, and what will happen? Darkening of the hairs, there is hair fall, and there is pimples. So I remember this as AHA, acne, hirsutism, and alopecia. Since we are Asians, Pinoy, Pinay, we are not expected to be having dark hairs. And so there is this scoring system that when we exceed four above, that's hirsutism already. So that's one of the clinical parameters of hyperandrogenism. So try to look at if there are hairs only at the sides here in the picture, uy, something is dark here. So tanawa basig bungot na siya, no? Is it, so say for example, you have a score of 1 there. Let's try score of 1. And in the chest, I noticed also some hairs around the nipple area. So that's another score of 1. I also saw hairs here, quite a lot. Okay, here. Okay, it's starting to become a triangle in the area. And apart from that, Doc, I also noticed some hairs here. 1. Okay. So in the arm, yeah, medyo dark, Doc. So in the back, none. So wala at the back. So what's the score? 1, 2, 3, 4, 5, 6, 7. So a score of 7 is already high, no? For a Filipino woman for us to be able to diagnose hirsutism. So pag isa lang, just the arm. So let's just, pag sa arm, what if isa lang, but there is too many? So 4, still hirsutism. So try to look at yourself. Again, 50% of PCOS patients remain to be undiagnosed. So try to look at yourselves, okay? Also, this has been noticed that the fat accumulation among PCOS patients are in the abdomen, okay? Adiposity that accumulates in the center of the abdomen. So we call this central obesity. Gagmay ugbukton pero dagkong bilbil. Okay, so that's how we describe it in our dialect. Now, what happens in insulin resistance? Why are we prone to diabetes when we have polycystic ovarian syndrome? Because normally when we take in food, the glucose or the sugar that we get from the food is being transported or is being absorbed in the organs through insulin. So insulin plays a very important role. So it becomes an energy, it becomes stored energy, or we can use it up through insulin. However, with insulin resistance brought about by polycystic ovarian syndrome, no matter how much insulin there is, but because of the fat or the cholesterol coating the organs, okay, the liver, the muscles, there are fat coating it. No matter how much insulin is there, the sugar that we take in from the food will not get in the organs because it's coated by the fat. And so it remains in the blood. And so when we get sugar in the blood, sugar is high. Okay. So next. Oh, here, this is a good algorithm showing the effect of obesity, no? Eating too much fat, gaining weight. Doc, in the past 6 months, I gained 10 kilos. During the pandemic, Doc, I was working at home and my only way to relieve stress is eating. And so I gained so much weight. What happens? So in the fat cells, there, as I was saying, aromatization happens. So itong aromatization, it is the conversion of the male hormone androgen into a weak estrogen. That's E1. Okay. While in the Adrenals, this is where hormones, also one of the areas, the periphery, that hormones are converted. Again, cholesterol is converted into androgen. So again, high androgen. While in the ovaries, if there is too much androgen, what happens? Estrogen also decreases because of the inhibition. Okay. While in the liver, what happens? If fat accumulates in the liver produces sex hormone binding globulin. What is this? No, I'll try to teach you the terms. No, so you will be your vocabulary in medicine will become wider. So sex hormone binding globulin. Sex hormone binding, from the name itself, it binds to the hormone. So what happens when a sex hormone binding globulin binds to a hormone? So that hormone becomes inactive. So it is biologically inactive, and so it will not give its effect. However, with obesity or high cholesterol, these sex hormone binding globulin decreases. What happens? There are more active hormones. There are more active male hormones, thus causing the acne, the alopecia, and the hirsutism. So that's the effect there. So all these allows higher bioavailability of androgen. So male hormone is elevated while producing a weak, more of the weak estrogen from the periphery. So there is unopposed weak estrogen. And what will happen if there is unopposed weak estrogen? So, oh, there. Okay. So, the most powerful destructor of insulin receptor is overnutrition, again, from the food, from cholesterol. So, here, obesity. So, what happens now if there is unopposed estrogen? You know, estrogen is the one that causes thickening. So, after menstruation, an elevated estrogen will start to replenish the lining that was left off during menstruation. But if there is weak estrogen, it will not cause the ovulation of the egg. So what happens? Dili ta dugon. So what happens? No, nanapoy lain ni baga diri. It's more, it's thicker. Now on the side, wag hapon ta duga. Ang tod, wala duga until it becomes very thick that the blood supply cannot supply anymore. The ones that are nagsiwil dinhi ka namang nagsiwil dinhi. So ang ending, what happens? Either mag-spotting, okay, spotting will happen, or mag-mens nga walay undang-undang. The menstruation will last about a month. And you know what's sad? Others will say, "Oy, it's normal because you missed 1 month. So bawi-bawi." No? So it becomes a normal occurrence. It's normal that your menstruation lasted for 1 month because last month you did not have your menstruation. So to compensate with a no menstruation, now you are given a month of every day with menstruations. But it's not normal. It should not be like that. Okay? So, but that's the effect of unopposed estrogen. And worse, so what? Okay na dok, magpanty liner lang me for the whole month. But you know what? Cancer loves to stay here in the thick area. No? Cancer always loves in thick areas. That is why one tip for us to avoid any form of cancer, may it be endometrial, breast cancer, is losing weight. Okay? Anything that is tambok, anything that is thick will really predispose us to cancer causing opportunities. Now, as I was saying, mo siya ang symptoms. No? The symptoms are abnormal hair growth, acne, no menstruation, and for those, I don't know who among you wants to get pregnant. Some would say, "Doc, no matter how I try to, what's this? Do a home preg test kit, it seems like it's not working." It's because nagkabuang po, this is the luteinizing hormone, because the luteinizing hormone is the hormone that is detected in home ovulation kits. And if a patient suffers from PCOS, the luteinizing hormone remains to be elevated, and so it looks positive all the time. So you will get confused. What else? There, I was saying about insulin resistance, balding, and well, recurrent miscarriage also is part, no? Doc, na trauma na ko because I was pregnant before and then nakuhaan ko. And then later on, when I tried to have another consultation, I was diagnosed PCOS. And so it's very difficult for me to get pregnant. Yes, that's a real story. And so we will be discussing that also now. So, PCOS is something that we will be able to discuss other diseases as well that is very much related among females, especially in the reproductive years. So the cause of PCOS, all you have to remember that the cause of PCOS is the elevated male hormone, or in the layman, we more commonly call it the testosterone, because normally it should be the female hormone that is high depending on the cycle. So as I was saying, when we are about to ovulate, no, estrogen is high, so that the lining of the endometrium, when fertilization happens, the lining of the endometrium is ready to receive the baby, baga, thick enough para mukapit ang bata. And then later spike at the second half of the cycle and then goes down for menstruation. While in PCOS, look, estrogen remains low and testosterone, or the male hormone, or the androgen, remain high. Okay, so that is the cause of PCOS. And so where does this come from? The excess androgen or testosterone comes from the disturbed ovulation. The ovaries was not able to function well because, again, it has been overloaded with cholesterol and male hormone, and so it was not converted into female hormone. Or there is excess insulin. With the excess insulin, sugar becomes high, the organs or the liver, the muscles cannot absorb the energy that we get from the food. And Penny, this one is most commonly asked because before it was not, genetics was not part of the PCOS, but now it was found out that mothers who with polycystic ovarian syndrome can pass on the genes to the baby, especially intrauterine, while the baby is still inside the tummy. When the mother is not able to modify her lifestyle, live a healthy lifestyle, she can pass it on to the baby. Inflammation. Oh, how do we get inflammation? Oxidative stress, if you're familiar with the term oxidative stress, can be destroyed by antioxidants. So antioxidants also are very popular now. What are antioxidants? Glutathione, folic acid, inositol. What are the other popular antioxidants? There are a lot. But the source of the inflammation come from the food that we take in, monosodium glutamate, the plastics that we use, those cause inflammation in the body. Or too much stress in the work. Grabe sa work, stress in the household, emotional stress, that is one cause of inflammation. And of course, lifestyle factors. If you smoke, if you keep on eating high meat diet, so those cause PCOS. So how do we manage then, Doc? You have been talking about how come a patient becomes or will have the polycystic ovarian syndrome. So what do we do? Well, we direct it towards the consequences. So this is a very good illustration on the consequences of polycystic ovarian syndrome. That is why it's also one of the reasons why I chose this topic, because it can encompass a lot of other issues. So polycystic ovarian syndrome, you just thought that acne can be solved by a derma. No, it is part of its spectrum. Hirsutism, mo nang maulaw na, maglakaw-lakaw, kay mura nag taong unggoy. Infertility, this is a very silent issue among women, perhaps because of the culture or the stigma, either by the family, they are being pressured to have children, or in a society like the Philippines where having more children becomes a stigma. And so this is very less likely talked about because more of our issues talk about how to control births. And so they felt that if they wanted to work up for infertility, it's not very significant. But actually, it's one very important factor that we should consider. we should consider when we talk about polycystic ovarian syndrome. Okay, so there. Also, there is also reduced quality of life, hypertension, depression. Doc, is it true that when a patient has PCOS, she will have or she will feel depressed most of the time? Yes, it's because of the changes of the hormones. Did you know that the male hormones cause depression or anger? What else? Yeah, mostly like that, no? It's the male hormone. So, masaputon na, sensitive, dali na mohilak, no? And of course, hypertension, even among the very young. I had a 21-year-old with an elevated blood pressure. She's quite heavy. And since she's just working at home, everything is accessible to her, order here, order there, no? So, there. Well, I mentioned also about endometrial cancer, and endometrial hyperplasia is just the beginning. Kung sa pagkaon pa, appetizer ang endometrial hyperplasia that will later on develop into cancer. So, depende. What do you need, or what concerns you more? So this is where we will address the management. Okay, so diagnostics, what we do, just the basic diagnostic tests. Okay, transvaginal ultrasound. So as you can see, case 1 and 2, transvaginal ultrasound was requested for us to check if there are other issues apart from the hormonal imbalance. As diabetes is very common among polycystic ovarian syndrome, even among the young, no? Even among those who are slim, bilis ko diabetic to quick, dili man ko tambo. There are still those with elevated blood sugar. And so 75 grams OGTT and HbA1c will be requested for them. Thyroid stimulating hormone, because the thyroid gland is another endocrine that affects the metabolism. And so thyroid stimulating hormone is among the tests we should check, because those with polycystic ovarian syndrome also suffer from hypothyroidism. It's a very common combination. So we check for both, because sometimes no matter how we try to lose weight, we are not able to lose weight. It's because our thyroid hormone has a problem, and a way to screen it is through the thyroid stimulating hormone. Next is lipid profile. So I kept on saying that an elevated cholesterol will produce more androgen and inhibit conversion into estrogen. And so we will have to check the lipid profile, okay, to check for the levels of cholesterol. Well, SGPT also. SGPT is a test for the liver, okay? As I was saying earlier, if you remember the liver produces the sex hormone binding globulin, but if there is too much cholesterol that coats it, it will reveal a high SGPT because the liver is destroyed. Plus, dugangan pag yung tagay, no? The alcohol destroys the liver. So there. What else? I think I have one more test. Yes. The anti-Mullerian hormone, or the follicle stimulating hormone, especially for those who had prior workup for infertility, you will notice that we will be able to identify if you have enough stores of what you call this, follicles, for you to be able to get pregnant. But this is not applicable to all. Again, I specified for those wanting to get pregnant only. But for wellness, okay, we are talking about wellness here, diba? Health concerns. For wellness, just test for diabetes, thyroid, cholesterol, and liver, and transvaginal ultrasound is enough. So here, if you can see in this algorithm, nalahi good. Those seeking fertility has a different pathway, while those not seeking fertility has a separate pathway. Again, our goal is to prevent the cardiovascular effects, the cancers that will form later on. And these medications You will know about this when you talk with your obstetrician. But if you can see, again, visit your OBGYN. This is not well, the pills can be bought over the counter, but since there are a lot of types of pills in the market, it is best that you talk it over with your obstetrician gynecologist to be able to give you the best pill that will fit what you need. Again, management will depend on the consequences that you want to avoid. There. But look, lifestyle modification is on top of the algorithm. It is I cannot overemphasize, but lifestyle modification is something that we cannot buy in the market. We cannot get through the supplements. It is something that we do on a daily basis. So what is the lifestyle modification? It is considered, imagine, a cornerstone of treatment for polycystic ovarian syndrome. Weight reduction is the first best treatment for obese women. So yes, I agree that there are some with PCOS who are lean, but majority are obese. And those who are obese, weight reduction is the first best treatment. In fact, a reduction of 2 to 5% can significantly improve metabolic and reproductive functions. Here, it is important to emphasize that caloric intake is more important than the specific composition of diet, because there are a lot of questions also coming in. What can you say about keto diet? What can you say about Mediterranean diet, etc.? So all you have to look into is the number of calories, because as I showed in the previous slide, overnutrition or very high caloric intake is the culprit of insulin resistance. And since we were talking about diabetes and insulin resistance, a lot ask about metformin. It's very amazing. Patients now are very educated. They Google first before coming to the clinic. And so I would appreciate that if you have questions, you let me know later on. Now, although treatment with metformin can facilitate weight loss by suppressing appetite, but the overall effect is modest and inconsistent. And so, again, case-to-case basis for metformin. Okay, well, these drugs are for those who wanted to get pregnant. So these are just good to know for you. If you wish to more know about this, especially for those wanting to get pregnant, just let me know later on. Okay. Well, this is also a common question. Doc, when I stop taking the pills, mabuntis na kahako, will I get pregnant already after the 3 months or the 6-month pill regimen you gave me? Okay, let's talk about PCOS and pregnancy. Now, can PCOS cause miscarriage? Because there was one of the symptoms of PCOS in that one slide in the last area I underlined na can PCOS cause miscarriage, or no, it was said miscarriage, no? In the last one of the symptoms of PCOS is miscarriage. So can PCOS cause miscarriage? What do you think? Is it a yes or a no? So I think if you were very attentive, yes, no? Yes, PCOS can cause miscarriage. And this is the reason behind it. It says here that PCOS is associated with increased risk of miscarriage. What's more, gestational diabetes mellitus, hypertension disorders during pregnancy, preterm delivery, and birth of a small, wala nakatubo, or too large for the gestational age infant. And so apart from miscarriage, there are a lot other consequences during pregnancy that PCOS will cause in our body. Now, infertility. I just have to talk about this because others would say, Doc, magpa-work up me because kanang wala gid binabuntis, no, for the past 2 years or 4 years. So just like case number 2, she's already 34 years old. For the past 2 years, she never been pregnant, no, even though they were trying. But infertility can still encompass those who are able to remain pregnant within the 5 years of exposure to pregnancy. Among these are those who got pregnant and miscarried. And so it's a very important topic to include about PCOS. So there. Also, a prolonged time to pregnancy is a known risk factor for other obstetric complications and adverse perinatal outcome and is often seen in women with PCOS. So kanabang karon 2010 nag-try sila og pregnant, 2020 grabe no, 11 years, 2021 wala gihapon nagbuntis. So that's an exaggeration, but a prolonged time from the onset of trying to get pregnant to being actually pregnant is one known risk factor for obstetric complications. So just a case, no? You know, I love giving out cases para mas relatable siya, no? Mr. and Mrs. AA, they're married for 8 years. Mr. AA is 34 years old, non-smoker. He used to be an alcoholic beverage drinker. BMI, so the body mass index. So when we talk about the body mass index, we look into the weight and the height of the person. So BMI of 22. So while Mrs. AA had 2 prior, so the reason for the Gravida 2 is that she had 2 prior deliveries that went to term, but her 3rd pregnancy, she had a miscarriage, okay? She was diagnosed to have PCOS. She was on pills for 3 months and she got pregnant, no problem. However, again, she miscarried, nakuhaan. And they had been trying to conceive because their eldest is already 8 years old, the second child is already 5 years old. So this will still cover the diagnosis for infertility because she miscarried and had been wanting to get pregnant for 5 years, okay? So these are the very important points: the body mass indices, PCOS as diagnosis, the management of PCOS, the pills, and the consequence. She miscarried. So if we look at WHO, we will see that the WHO Pacific guide, Pacific Asia Pacific has a different range for the general BMI. As you can see, Mr. and Mrs. AA still belong to the normal BMI in the general WHO BMI ranges. However, in Asia Pacific, since we are Filipinos, Mr. AA is just barely in the normal range because his BMI is 22, while Mrs. AA's BMI is already overweight. In fact, also at the borderline going obese for Asia Pacific. So try to compute. We have BMI calculators in Google. You can try to input your height and your weight there, so you will know what's your BMI. So as you can see, in the 5 fingers, this is how PCOS is being triggered in the body and how we will address this. But this is very general. Insulin resistance and obesity, you do exercise, accumulation of toxins, so stop eating junk foods. You boost your immune system, you switch to organic food, and be joyful always. So these are very general, but I want to be more specific para it's more practical for you and easy for you to remember. So diba, at the top of the algorithm, it says lifestyle modification. And so goals should be achievable. Diba, SMART, teachers I think are familiar with the acronym SMART. So A stands for achievable. So there should be a goal that a 5 to 10% weight loss should be achieved within 6 months, okay? It's not realistic for us to let a woman lose weight 10 kilos in 1 week. No, that's impossible. But, you know, 10% of the weight within 6 months is very much achievable. So, for example, she weighs 70 kilos. So, math teachers, what's 10% of 77? So, at least by, you are July now. So, by December, patient should be at least minus 7, 63. So ba? Yes. So by December, our patient should be at least 63 kilos. Because again, the 10% should be achieved within the 6 months. Okay? So that's the sagad. Okay? If she can achieve 60 kilos by December, sure, why not? No? It is It is just a range that at least we should be able to reach within the next 6 months. Okay, what I do, I always advise once a month visit with a gynecologist because in lifestyle modification, we will be able to do it in the first month, but relapse is very much common in the second and the third month. Mabalik ba sa old habits, and so it's very important to follow you up. So that's why it's a monthly visit. And again, matingala niya mo if you will exchange papers with your patient with your co-patients. You might realize, hala, we have a different management because I'm a lifestyle medicine specialist. My care is patient-centered and individualized. So I will always look at how I can help you transition better. And so I will always look at you as a whole, as an entire patient, not just the PCOS. I will try to look at how I can help you transition. So, for example, your issue is more on the food. Then I will focus more on modifying your food intake. While patient B her issue is more on the physical activity, but not so much in the food because her food is quite healthy. And so I will focus more on physical activities for her. So that's why it's called that's why it's individualized. So okay, there should be goal setting, self-monitoring. What I usually do with my patients, I let them make their own food diary. I always tell them, please do not censor because I will not judge you. But it's a good thing because it's a form of self-monitoring. Even when they do not show it to me every day, they will be able to reflect on the things that they eat by just writing it down. So if you write down donut, chakoy, budbud, suman, biko, no, you will see that it's, oh my, I'm eating so much of the saturated fat. So it becomes a reflection for you. And of course, as a doctor, as a lifestyle medicine specialist, I always assess the readiness to change. You can also assess yourself, okay? So we call it that trans-theoretic stages of change. How does it look? It looks like this. So pre-contemplation, you are not even aware that PCOS exists, and so we always thank that this opportunity of learning that this has been introduced to us, and that any one of us can be at risk. And contemplation, maybe I will change, no? I will change, but maybe in the future. So not very aggressive yet. While preparation, you have your rubber shoes with you that for the next 6 months you'll be able to modify your lifestyle. Action is you're already doing it, but it's like less than 6 months just yet. While maintenance phase is that you are able to sustain your lifestyle change for the past 6 months and more. And so at least through this educational platform, at least we will be here, no? I have to exercise and change my lifestyle on the eye. So this is really my goal for all of you. You will be in this stage of change, not the preparatory or the preparation phase. So, well, this is very important. Like you, the teachers, I think this is how we approach the students. We always start with what they are good at, diba? She is good at this, or he is good at this and that, but he has or she has to improve on these areas. So just like us, the doctors, we always emphasize on working on the areas where the patient will see quick success. So for example, our goal is to have 30 minutes of exercise a day, and that person is an active person. So exercise for her is not very difficult. And so I emphasize on those areas. So when she comes, oh, wow, good job. You're very good in your exercise. Okay, but she has difficulty on the food intake. So we'll talk about it at the later part of the discussion. No? I always start with something that the patient is good at to, of course, encourage them also. Okay, general healthy eating principles should be followed. Again, there is no specific diet plan or diet regimen or meal plan, no? again, the goal is to decrease the calories, okay, the bad cholesterol. And a very common question, is weight loss part of the goals of management? Because again, yes, those obese are very common with PCOS, but there are really some who are lean. Should they lose weight as well? So again, there is no one dietary type recommendation for PCOS, but for those with excess weight, there should be a deficit of 500 to 750 kilocalories per day, meaning there should be more physical activity than the food that we take in. So exercise, how do we assess our exercise? So this is a basic recommendation among those from 18 to 64. So I think we all belong to this range now. Minimum, okay, this is the minimum of 150 minutes per week of moderate intensity physical activity. Doc, walking man ko 30 minutes every day, Monday to Friday. So that's how much? That's 150 minutes, right? How intense is the walking? Wala na good, Doc, walking lang sa park like that. So that is light or minimal intensity physical activity. Moderate intensity physical activity is when you can still talk with your walking mates, but you cannot sing anymore. So if you can sing and talk and even laugh about things while walking, it's not yet moderate intensity physical activity. So usually what I tell them is 30 minutes of walking exercise, Monday to Friday. Or if you are only available on the weekend, since our goal is 150, so unsa may half? What's the half? 75, right? 75, 1 hour and 15 minutes every day for Saturday, Sunday. So we call you, if you only do it on the weekend warriors. So you do your exercise on the weekends. But if you can do it Monday to Friday, so that's 30 minutes only. While if you are doing vigorous intensity or high intensity, so 75 minutes per week will do as minimum. Okay. For those good, Doc, we cannot really manage the exercise. Then you do 10-minute bouts. Okay? 10 minutes bouts 3 times a day. So total of 30 minutes. So 10 minutes in the morning, 10 minutes in the after lunch, 10 minutes in the evening after your dinner. And you achieve around 1,000 steps. So how do you achieve 1,000 steps? It's either you count manually or have your smartwatches with you. It will help now in the walking. Again, this management is for general health principles, not only for PCOS patients, but for all patients, supposedly for us to be able to maintain physical activity. Again, minimum of 150 minutes per week. That's 30 minutes Monday to Friday or 75 minutes Saturday, Sunday. If you want more, then of course, more is welcome. Okay. So this was the case previously. Now they are 10 years married, so 2 years ago, and both Mr. and Mrs. AA underwent lifestyle modification. And look, the BMI of Mr. AA from 22 is now 21, while Mrs. AA also's BMI is also 21. And with the lifestyle modification, they are able to have a healthy rainbow baby girl. That's what they call to babies born after a miscarriage. It's like a rainbow after the rain. So, and guess who that is? This is the rainbow baby girl. Just like how lifestyle modification has changed Mr. and Mrs. AA, the rainbow baby also eats fruits and veggies for snacks. So that's just a snack for her. And yes, and there, okay, she loves eating. Okay, and that's her second birthday. Okay, that's her second birthday, all plant-based. It may look like there is meat, but all are veggies or plant-based snacks, high in fiber, and even the spaghetti is sweet. No? So there, it takes commitment for us to be able to sustain this lifestyle. And there, I'm the Rainbow Baby Girl's mom. I am Mrs. AA. I suffered a miscarriage after I was diagnosed with PCOS because of my very unhealthy lifestyle when I was training. And I always put it to a point that whenever I talk about PCOS, I always share my experience that yes, it can happen to any one of us. There's no exemption. Because apart from genetics, epigenetics is there, especially with the unhealthy lifestyle that is left and right, front and back. No, it's the unhealthy food is there, the unhealthy lifestyle is there. Netflix, you can lie down and the entire day you can watch K drama. No, so it's very unhealthy, and I have to put credit to my family because they have helped me um, endure, survive, and fight against PCOS. No? Without them, I will not be able to maintain a healthy lifestyle. They have contributed a lot and so much majority of the lifestyle that I have now. And so this means that our battling PCOS and all these other endocrine or lifestyle factors, we need somebody to help us. We cannot battle this alone. And so I have to thank especially Dr. Longinas for allowing me to talk to you about this issue, the very popular issue on PCOS and other health related concerns. Because again, this can happen to any one of us, and we can be a very important factor in helping somebody else's life become better. Because somebody else may be suffering PCOS in the family. It can be your daughter, your sister, and it is important for you to realize that your role for her to be able to battle PCOS is very significant. And so now we come to a point to summarize, no? Again, the source of too much cholesterol is overeating, a sedentary lifestyle, being overweight, and too much stress. So this is just a very easy practical tip for you. This is what I do as well. You go to YouTube, you type walk a mile, and you will see that this video is only 30 minutes. See, it's only 30 minutes, no more, no less. So it has warm up, the exercise itself, and the stretching later on. So I would recommend this one for you too. It's very easy to do, and you can just do this at home. No need to go out, buy some gears, etc. You can just do this in your sala. And that's me. This is how I prepare the breakfast. No, we just slice the fruit. Nothing expensive. Nothing really fancy. No, I just slice avocado, manga, melon, apple, saging. No, those are very simple fruits that we can buy in the market, and then I slice it. And actually, this is one whole bowl. But because I'm quite busy, I eat in the. This is not good, no. Ideally, you should eat in your table. But this is how I consume my breakfast. At least I get to have a healthy meal. So that's how my breakfast is being prepared. Or if not, you can blend. Juicing, there's a question about juicing. You will be losing the fiber when you juice. No, kind of squeeze lang. So the best is to really blend. So together with the nutrition is the fiber that is in the fruit. So there. For those wanting to get pregnant, Our Lady of Guadalupe Natural Family Planning Center Philippines, whereby I'm the founder, together with my husband, we will help you determine ovulation. So again, this is for those who want to become pregnant, no? Identifying fertility. And yes, I am very accessible online. If you want to learn more, there are other topics that you wish to learn. I have it in my YouTube channel. You can just type DocSheet TV and you will be able to scroll down other topics that you wish to learn. Rest assured that all these are based on medical literatures, not just to or I don't know what the others basis is. And if you wish, again, to have a consultation wherever you are, we have virtual consultation available. Or if you wish to go to the clinic, it's all the information you will find in my Facebook page. You just have to type Dr. Jalad-Armero OBGYN Lifestyle Clinic, because again, we don't have to sacrifice our health just so we will be safe from COVID. We can always have it at the comfort of our home through virtual consultation. So you just stay home, and we'll talk from your place to my place. Okay. So here, these are the samples of my patients whom I do virtual consultation. Even with the limitation of the COVID pandemic, we do everything online. No? From face to face, we do it online now. And to summarize, no, I want to summarize my talk with the acronym of PCOS, since we are also talking about PCOS and other health-related concerns. P for prepare. Prepare and assist women with the necessary and correct information and resources. So what we are doing now, this is the letter P. We are preparing you and giving you correct information and resources. The next is letter C. Communicate information in a platform that is friendly and accessible. So the online delivery of health concerns, whatever, is a very healthy platform for all of you. So I wish you will be able to maximize my talk and, reflect on the things that you can work out on. And once that you are aware, that you are able to communicate, oh, I lack on this one, I think I need to invest more on my health, then you try to overcome the fear of the disease. Because one reason why patients do not like to go and seek consultation to gynecologists, because they're afraid that they might be diagnosed with a disease. It's not all the time that you go to us only when you have problems. You go to us for wellness. Again, my lecture is more about wellness and giving you awareness. And so do not be afraid that you will be diagnosed with the disease, because even when you will be diagnosed with the disease, if you come regularly, religiously, it will be easier to battle that disease. As I was saying, I too am a patient. I suffered PCOS, but because I was able to manage it well, no, with a very religious follow-up, maintenance of the lifestyle modification, I am able to overcome and battle the disease. So, and lastly, again, I should always put this in your heart, okay? That a support system, a support network is very significant in our road to wellness, because these people are the one who push us to become healthy. Diba? As one advertisement always say, para kanino ka bumabangon, they are the reason why we should stay healthy. And so have a great support system. I think this is my last slide. Thank you very much. Once again, if you have questions, you can reach out through my email address, which Dr. Luminas has, or you can communicate with me through the Facebook page I have shared earlier. Thank you very much, and thank you for this opportunity. I'm glad to be able to meet you all through this platform. God bless us all.